Question.
First, never lift anything or anyone that you cannot comfortably handle. Prepare to lift with your feet a shoulder width apart, back straight, and one foot slightly in front of the other. We'll call that the proper stance. Also, let the legs do the work, not your back. Rule number 2, plot out your move and be sure of what you can and cannot do. If your loved one can help with the move, let him or her do so. Also, make sure that your loved one's socks or footwear do not have slippery soles. Rule number 3, make sure you don't have to move someone too far from where you're starting. Bring a chair or wheelchair close to the bed, for example, lock the brakes, and keep foot and arm rests out of the way. Always let your loved one know what it is you're planning to do. Be gentle but direct. Before you lift, get as close as you can to your loved one and avoid having his or her arms around your neck. You could both fall that way. Remember to keep the proper stance, back straight, knees slightly bent, and weight balanced evenly. Now pivot and don't twist your body towards your destination. As you pivot, relax the shoulders and begin to lower. At the toilet, have your loved one hold on to a grab bar while you help with clothing. Notice the elevated toilet seat here. It's a big help if your loved one has knee problems or trouble with walking because it reduces the distance needed to lift or lower. It simply rests or bolts onto the regular seat. If no grab bar is available, pull the chair up diagonally to the toilet, move away the arm and foot rests, and help your loved one swing over to the toilet seat and then back when the toileting task is complete. If you're moving your loved one into a car, roll the wheelchair up close to the passenger's seat, lock the chair's wheels, move the footrests, and lift him or her up. When you are both standing, pivot toward the car seat and lower him or her into the car, making sure the head doesn't bump into the frame. Then, with your hands under your loved one's knees, lift his or her legs into the car. If you're putting your loved one to bed, first sit him or her on the bed's edge and as far back as possible. Then, gently lift and swing the legs onto the bed. This will help his or her upper body to roll into place. Once your loved one is lying flat, place a small pillow under his or her head to allow for the spine's natural curvature.
Okay, Jimmy, I'm going to push you up a little bit.
To move your family member further up on the bed, get him or her to help by bending the knees and, if possible, pushing up against the mattress.
There we go.
To help your loved one sit up on the edge of the bed, put one arm under the shoulder blades and the other arm under the knees. Get in the proper lifting stance and tell your loved one exactly when you're going to move. Gently bring the legs over the edge of the bed as you lift his or her body into a sitting position. What we've been showing you here is how to move or position your family member safely, but accidents do happen, and despite all our good intentions and efforts, your loved one may fall. If it's a slow slide to the floor while you're moving your loved one, let him or her down gently to the floor. If you try too hard to hold him or her up, both of you may risk injury. On the other hand, if the fall is hard, call 911 and get professional help for your loved one as soon as possible. So, how do you get your loved one up off the floor once he or she has fallen? If your loved one doesn't use a wheelchair, help him or her get on hands and knees and then bring the strongest foot forward while half kneeling on the other leg. Now, with a chair or other sturdy object in front, help your loved one pull up with his or her arms and push off on the stronger foot to a standing position with both feet together. None of us enjoy being forced to eat foods we don't like, so it's important to get your doctor's advice on a good nutritional plan that your loved one will like. Offer as many fruits and vegetables as possible in the diet. For bowel health and to keep your loved one regular, add a daily dose of a fiber product to his or her food or drink. It's important to know that some food and medication combinations don't work well together. Some combinations may cause gastric distress or even interfere with the medication's effectiveness. Grapefruit juice, for example, is a poor match with over 50 medications. It interferes with digestive enzymes and blocks medications from being properly absorbed. As a result, when too much medication accumulates in the body, serious side effects can occur. We all can become ill when food is not properly made, but it's older people or those who have weaker immune systems who suffer the most when carelessness occurs. So it's important to prepare food in a clean environment and to cook it at the correct temperature. Too much salt or sugar is not good for your loved one, so check food labels for these ingredients. Also, taking the salt shaker and sugar bowl off the table is a good idea. If it's out of sight, it will probably also be out of mind. And stay away from busy dinnerware patterns that may confuse or make the food harder to see. Studies show that people with Alzheimer's will eat almost 25% more food if it stands out in higher contrast to the plate on which it's served. Trouble with swallowing can lead to choking, and if food or liquids are inhaled, this can lead to inflammation of the airway and lungs, which can then cause aspiration pneumonia. Also, be sure to address swallowing or choking problems due to dental issues or poorly fitting dentures. For those prone to choking, don't offer hard-to-chew foods like nuts or popcorn. These can easily get lodged in the windpipe. A liquid thickening product like Thicket can make it easier for your loved one to swallow soups and drinks with less risk. And if your loved one can only eat soft foods, a good blender or food processor will give most foods the desired consistency. Special drinking cups and no-spill mugs have easy-to-grip handles and are sometimes weighted at the bottom. Bending straws in covered cups make sipping more manageable too. Eating utensils in large or special curved designs help the user to grip more firmly. This is especially useful for those with tremor conditions like Parkinson's. And also very useful, non-skid dinnerware that holds a plate or a bowl firmly with a suction base.
Having trouble with that? Yeah. Okay, let me give you a hand.
If your loved one needs to be hand-fed, make sure the food is not too hot or cold. Cut the food into bite-sized pieces and tell your loved one what you're offering on the fork or spoon. Sips of water between bites are also a good idea. Sometimes you may have to prompt your loved one to open his or her mouth. If he or she rejects food or spits it out, take the meal away and try again in a little while. Have your loved one brush his or her teeth twice a day with a soft bristled toothbrush. If help is needed with brushing, or if your loved one has memory loss, you can gently assist in the process by first placing the brush in his or her hand and guiding the brush gently towards the mouth. He or she may remember how to finish the task once you've started it. An electric toothbrush may make things easier yet and may be even better at cutting down on periodontal disease. Monitor your loved one's brushing for 2 to 5 minutes to make sure that plaque is removed. Flossing keeps gum disease at bay. So, just as you did with the toothbrush, offer your loved one the floss and see if he or she can use it without help. If not, you can do the task yourself.
Here, let me help you.
If you have trouble using string floss, a floss pick might be an easier alternative. And still another alternative is an oral irrigator, which shoots or pulses jets of water to remove debris from between the teeth. There are manual as well as electric irrigators available. If your loved one doesn't brush or floss after each meal or snack, it's important to get him or her to at least rinse. Offer a cup or bottle of water for rinsing out over a sink or emesis basin. If more help is needed, you might spray the inside of the mouth with a spray bottle, then gently clean out any remaining food with a slightly dampened Toothet oral swab. An oral irrigator can be used for this purpose as well. Just like real teeth, dentures can also accumulate plaque, so they should be brushed daily and should not be worn to bed. Gum tissue benefits from natural cleansing by saliva and an overnight rest from dentures. You can help your loved one to bathe in one of 3 ways, using a shower, a tub, or a sponge bath. No matter which of these you use, your bathroom should be equipped with grab bars, a detachable shower hose, and a bath chair or bench. These will help prevent falls and make bath time a lot easier for you. Start the bathing process by gathering together all the personal care supplies you'll be needing. Make sure you have a safe, warm, and dry bathroom. Remove any objects in the way of your loved one's path. Place a bath mat outside of the tub or shower, and a rubber mat on the tub bottom or shower floor.
Hey, Jimmy, you ready to take a shower?
When showering your loved one, choose warm water and mild water pressure. And if he or she is shy, drape a large towel around his or her body. Guide him or her gently to the seat or to the grab bar if standing is preferred. Let him or her feel the water temperature and handle the shower head if necessary. When washing the hair, it's best if your loved one is seated. The detachable shower hose and a well-placed washcloth can help keep soap away from the eyes. Make sure the bath is thorough by cleaning under all folds of skin. After the shower, gently help your loved one onto the floor mat and wait until he or she is out before turning off the water. You don't want your loved one to get chilled or scalded. Lead him or her to a nearby chair or even the toilet seat, and you can begin the drying process.
Okay, we're going to wash you off.
Have your loved one sit on a towel-covered bathroom chair or toilet seat, or stand at the bathroom sink. Fill the sink with warm water and add a bit of soap to it, not too soapy, however. Now, using a few washcloths, start washing your loved one from the top and work your way down the body. Again, let your loved one do as much as possible by showing, telling, or guiding. Now, refill the sink with fresh warm water, and with clean washcloths, remove the soap by wiping down the body all the way once more.
Ready?
A gentle lotion is really good for dry skin. You can apply it over your loved one's body, including feet and hands. Massage it in, then towel off the excess. And don't forget to apply common cornstarch under folds of skin to keep areas dry and rash-free. Make sure your loved one's hands and feet are dry, and take time to inspect them for any irregularities. Use a nail file regularly to keep finger and toenails at manageable lengths. Shaving in general is best done with an electric shaver. Your loved one can use it safely, plus it can provide him or her a measure of independence. If you must use a safety razor, however, you are the one that should be doing it, and not your loved one. After bathing and grooming, it's time to get your loved one dressed. Keep your loved one's wardrobe simple, with easy-to-manage pull-on clothing and fasteners using Velcro, elastic bands, or large buttons. Lots of zippers and small buttons will be frustrating or confusing. If your loved one can still dress independently, you might lay clothes out so that he or she won't have to make choices that can so often lead to frustration. And lastly, your loved one's shoes should be low-cut with soles that are lightweight and don't tend to slip.
Time to take your medicine, Grandma.
I don't need to take medicine. Who said I have to take medicine? For what?
Remember, Dr. Brown said you have to take medicine for your blood pressure and your diabetes. He even wrote a note. My patient, Aura Jackson, that's you, needs to take her blood pressure and diabetes medicine every day. So let's take your medicine for Dr. Brown.
Okay, I'll take it today.